Welcome to Module 5 Overview. The topics covered in this module are related to medical and psychosocial aspects of chronic illness and disability knowledge domain, which encompasses 9.3% of the questions on the CRC exam. The information in this module is organized into 3 lessons. 1. Psychosocial and cultural impact of disability. 2. Medical aspects and implications of disabilities. And 3. Human sexuality and disability issues. Learning objectives. The CRC exam includes 2 major sections, rehabilitation and disability, and counseling. For the rehabilitation and disability section, by the completion of this module, you will be able to define and identify the psychosocial and cultural impact of disability, define and apply medical terminology, describe the medical ramifications of various disabilities, determine the implications of medications on individuals with disabilities, and recognize environmental and attitudinal barriers for individuals with disabilities. There are no counseling learning objectives for this topic. The learning objectives and topics covered were generated based on information provided on the CRCC website. Module 5.1, Psychosocial and Cultural Impact of Disability. Topics covered in this module are impact of disability, family response, and barriers for individuals with disabilities. Impact of disability. Disability presents several challenges that can affect an individual's ability to adapt to the new circumstances. Individuals with disabilities may experience difficulty performing daily functions, challenges building relationships with friends, family, and society, or pain as a result of a medical treatment. It is common for an individual to experience a variety of emotions, especially when discovering they have a new disability that impacts their daily life. Psychological response of an individual. The adaptation, adjustment, and acceptance model is often used to describe the process individuals with disabilities experience as they adjust to their potentially new lived experience. Adaptation is the process an individual experiences as they work to find a sustainable relationship within the interaction between their disability, their environment, and society. Adjustment occurs at the end of the adaptation process when the individual has found a sustainable relationship within their environment and society. In the final stage, acceptance occurs when the individual can incorporate the disability within their sense of self without undervaluing their own worth. Adjusting to disability. There are 3 ways that individuals with disabilities often cope with disability. Disengagement-oriented. This strategy is where the individual will avoid the extent of the disability or ignore it altogether. Disposition type. This strategy is where the individual attempts to accept and focus on the positives as part of the coping process. And engagement-oriented strategy. This strategy is where the individual focuses on triumphing over the limitations of the disability. Additionally, there are multiple models that summarize how an individual may cope or come to accept a disability. Disability acceptance model. In this model, succumbing means a client has given in to the challenges associated with disability, which does not allow for adaptation. The opposite of succumbing is coping. According to Wright, 1983, there are 4 changes that are required to build acceptance. 1. Enlargement of the scope of values, focusing on the beliefs and ideas that are not in dissonance with the disability. 2. Subordination of the physique, focusing on the characteristics or traits that are not visible, e.g. intelligence. Containment of disability effects, focusing on other behaviors that the individual can do that are not challenged by the disability. 4. Transformation from comparative status to asset values, focusing on one's own individual characteristics or behaviors without making comparison to others. And finally, disability acceptance, when an individual can accept their disabilities as part of themselves without reducing their own sense of worth. Disability centrality model. This model argues that an individual's response to disability is based on their perception of control over their environment, circumstance, and health. As a result, an individual's satisfaction with life is initially reduced with the onset of a disability, which means the individual is less likely to engage in activities that cause contentment. Over time, an individual with disabilities' life satisfaction will continue to increase again. Stages model of adjustment. There are multiple models that describe the process of adjusting to disability. In one model, LIVNA describes the individual's progress through 5 stages. 1. Initial impact, shock and anxiety. 2. Defense mobilization, bargaining and denial. 3. Initial realization, depression and anger. 4. Retaliation, outward anger or aggression. And 5. Reintegration or reorganization, acceptance and adjustment. Stage models are often criticized because individuals don't usually adjust in a linear and ordered manner, where the adjustment process is often more dynamic and complicated. Somatopsychology model. This model describes that an individual's reaction to disability is swayed by external and social influences. Since it is not always possible to change the beliefs about the external social influences, a rehabilitation counselor can help the client engage in more positive behaviors by improving the client's beliefs about disability. And stress coping model. This model occurs when an individual experiences a circumstance that causes them to react with stress beyond their normal ability to handle stress. The individual's ability to respond to the stressor is called coping. Coping is exhibited as a positive change to the cognitive, emotional, or behavioral responses. Some common coping strategies include denial, denying the affect or impact of the disability; regression, existing in an earlier stage of development, such as a more dependent or childlike state; compensation, becoming stronger or more functional in another area to negate challenges; rationalization, creating reasons that are acceptable to the individual for the behaviors they exhibit; and aversion, turning negative feelings or actions into more common and socially acceptable ones. Family response. When an individual experiences a disability, the disability may also impact the support system of that individual, such as their family or friends. Disabilities often occur as a result of an emergent circumstance, which may cause the family to experience bewilderment, shock, denial, anger, or hostility. It also may cause families to take on new roles for the individual with a disability, such as a caregiver role. At times, this can lead families to feel resentment or guilt. As a result, families may encounter adaptation, adjustment, and acceptance issues alongside the individual with a disability. Conversely, a family may also encounter positive emotions or find an increased cohesiveness across the family unit. An individual with disability may be overwhelmed with feelings of support from loved ones, or the family unit may feel a sense of resiliency in their adjustment to the new circumstances. A family's response to discovering that their loved one has a disability is dependent on 4 characteristics. 1. The family's ability to manage stress. 2. The support available to the family. 3. The caregiving skills of the family. And 4. The family's perceptions of people with disabilities. The first action that a counselor should take before beginning treatment is to absorb as much information as possible about the perceptions, skills, and circumstances of the family. Through this information gathering process, a counselor may be able to better identify individualized needs for the family and client. Barriers for individuals with disability. Individuals with disabilities commonly experience barriers at work, in their living circumstances, or when interacting with society. Environmental barriers. Barriers that exist within an environment can be particularly problematic for individuals with disabilities. Physical barriers can exist, such as inaccessible restrooms, elevators, or seating. Transportation that is inaccessible is an example of a barrier that makes it difficult for individuals with disabilities to go to the grocery store, get medical treatment, go to work, etc. The workplace can often include significant environmental barriers. It is essential that employers provide workplace accommodations for employees with disabilities and follow relevant laws and ADA compliance. A counselor can help employers provide job modification and environmental alterations, such as making existing facilities accessible, modifying work schedules, or providing voice-to-text software. If reasonable accommodations are not enough for the employee to perform the responsibilities of the position, then it might be necessary for the employee to seek other means of employment. Attitudinal barriers. An individual with disability may experience attitudinal barriers as a result of society's incorrect perception of what it means to live with a disability. It is not uncommon for society to exhibit adversarial attitudes towards individuals with disabilities. Some attitudes experienced include victim blaming. This reduces the fear that the disability could happen to the non-disabled individual. Disability is a burden. Individuals with disabilities should be pitied. Stereotyping, societal norms or media portrayal. Individuals with disabilities are unintelligent or sick. Many negative attitudes stem from the Nazis and eugenics eras, where the appropriate course of action was to jail or exterminate individuals with disabilities. As a result, individuals with disabilities now experience microaggressions or discrimination. Attitudinal barriers are best overcome by helping the non-disabled individuals minimize their beliefs about the differences between disabled and non-disabled individuals. Providing correct information to the stereotyper or placing the stereotyper in a circumstance that helps them safely experience the disability are great interventions to help push the attitudes in a positive direction. Societal barriers. There are many factors that can influence society's attitude towards individuals with disabilities. Some factors include 1. The ability of the individual with a disability to function in a specific environment. 2. The type of disability. 3. The lived experiences of the person. A counselor can help change society's negative perception of disability using several strategies. Experiential strategy. In this strategy, the counselor provides more opportunities for non-disabled people to interact with individuals with a disability. Informational strategy. In this strategy, counselors help expose false beliefs about disabilities in non-disabled individuals by teaching them the realities of disability symptoms and limitations. And simulation strategy. In this strategy, the counselor provides a safe opportunity for the non-disabled individual to experience the limitations of disability. Module 5.2, Medical Aspects and Implications of Disabilities. Topics covered include medical terminology and abbreviations and medical aspects of disability. Medical terminology and abbreviations. As a rehabilitation counselor, you will work with clients who have a variety of different medical and mental health issues. Therefore, it is important to have an understanding of the different forms of disability your clients may experience, as well as the medical terminology to help you communicate with doctors and other medical personnel. There are 4 etiologies, i.e., the original cause of a disease or disability, of medical disorders. Understanding the etiology of a disability can help the counselor better understand the needs or course of treatment for the client. Degenerative. The disabilities develop and progress after birth or as an individual ages. Parkinson's disease is an example of a degenerative disorder. Congenital. These disabilities are inherited or environmentally induced disorder that occur while a child is developing in utero. A congenital disability can result from either or both parents of a child. Spina bifida is an example of a congenital disorder. Acquired. These disabilities occur as a result of a specific incident, such as an accident or environmental circumstances. Paraplegia, as a result of a car accident, is an example of an acquired disability. And unknown disorders. For some disabilities, it is impossible to know exactly how they originated. Medical abbreviations. Rehabilitation counselors will often have to read health records or communicate with clients' medical health professionals. Therefore, it is important for you to read and memorize the following list of medical abbreviations because these terms will show up on the CRC exam. ABP, arterial blood pressure. AEA, above elbow amputation. AFO, ankle foot orthosis. Lowercase a and b, ambulating. A/O, alert and oriented. APH, aphasia. C with a line over it means with. CAD, coronary artery disease. CHD, congenital or coronary heart disease. CHOL, cholesterol. CNS, central nervous system. C/O, complains of. COPD, chronic obstructive pulmonary disease. CRD, chronic respiratory disease. CVA, cerebrovascular accident. DD, discharge diagnosis. DM, diabetes mellitus. DX, diagnosis. FH, family history. F/U, follow-up, FX, fracture, GI, gastrointestinal, HBP, high blood pressure, ICF, intracellular fluid, IUC, intrauterine catheter, IV, intravenous, LBP, lower back pain, LE, lower extremity, LOC, level of consciousness, MA, mental age, MH, marital history, NOS, not otherwise specified, N period, nerve, NG, nasogastric tube, OBS, organic brain syndrome, OD, right eye, O/E, on examination, OHD, organic heart disease, OPD, outpatient department, OS, left eye, PNI, peripheral nerve injury, PVD, peripheral vascular disease, QAD period, quadriplegic, RDS, respiratory distress syndrome, RO or R/O is rule out, ROM is range of motion, RX, therapy or prescription, lowercase s with a line over it is without, STD, sexually transmitted disease, SX, symptoms, TENS, transient electric nerve, THR, total hip replacement, TMJ, temporomandibular joint, TX is treatment, UCD or UCHD is usual childhood diseases, UGI, upper gastrointestinal series, XR is x-rays, UE, upper extremity, U/O, under observation, URI, upper respiratory infection, and UTI, urinary tract infection. Medical aspects of disability, physical. Multiple sclerosis. Multiple sclerosis, or MS, is a disorder that affects the brain and spinal cord as a result of damage to the myelin sheath. The exact cause of MS is unknown, but a combination of factors likely contributes to the disease. A disturbance in the immune system is likely a major factor. The severity of MS is influenced by the degree of plaque buildup in the brainstem, cerebellum, spinal cord, optic nerves, and white matter of the brain. It can be difficult to predict the symptoms that MS will cause, and MS symptoms may be unique to each individual, but common symptoms include memory problems, pain, fatigue, numbness or tingling, blindness, or paralysis. Medications can help slow the course of the disorder. These include injectable interferon beta 1A or 1B and oral medications such as teriflunomide, dimethyl fumarate, and monomethyl fumarate. Because the symptoms of MS often develop gradually and are unique for each individual, it can be very difficult for individuals with MS to adapt and adjust to the disease. A rehabilitation counselor should provide social and emotional support as part of the rehabilitation process. Spinal cord injury. A spinal cord injury, or SCI, results from injury to the spinal cord nerve or nerves in the spine. SCI can either be complete or incomplete injuries. In a complete injury, a SCI leaves the individual with no sensory function or movement below the area of injury, where an incomplete SCI results in some sensory function or movement. A spinal cord injury can cause a person to become quadriplegic, arms, hands, trunk, legs, and pelvis are affected by the injury, or paraplegic, trunk, legs, and pelvis are affected by the injury. Medication used to treat the symptoms of SCI include NSAIDs like ibuprofen, acetaminophen, anticonvulsants, and opioids. Many individuals with SCIs require modifications to their everyday life, including accessible forms of transportation, building access, as well as social and emotional support. SCIs can have an extreme impact on an individual's lived experiences because it can cause loss of mobility, chronic pain, muscle spasms, issues with bladder or bowel control, and challenges with sexual function. Stroke. Stroke results when the brain is prevented from receiving the necessary oxygen because of restricted blood flow. This causes tissue damage to the brain that results in injuries to and functional limitations in multiple areas of the body, such as mobility limitations, difficulty with speech or communication, or vision problems. The functional limitations and other symptoms of a stroke may cause a person to lose their job or disengage from social activities that they previously enjoyed. Victims of stroke may encounter a wide range of environmental barriers, such as mobility barriers, like a lack of wheelchair-accessible lifts, inaccessible transportation options, and negative societal attitudes from others. Traumatic brain injury. A traumatic brain injury, or TBI, results from a violent force to the head which alters the functionality of the brain. As an example, falling accounts for nearly half of hospitalizations related to TBI. Car accidents and violent assaults are the most common causes of TBI, and suicides involving guns are the most common TBI-related deaths. The Glasgow Coma Scale, or GCS, is a system used to characterize the extent of a brain injury by the responsiveness of the patient. The GCS ranges from a score of 3, more severe, to 15, least severe. A GCS score of 8 or less means there is a severe injury to the head. A GCS score of 9 to 12 means there is a moderate injury to the head, and a GCS score of 13 to 15 means there is a mild injury to the head. Individuals with TBI may receive anti-anxiety, antidepressants, anticonvulsants, opiate, and/or antihypertensive medications to relieve symptoms from their TBI. Sensory. Hearing impairments can be severe or mild, as well as temporary or permanent. Hearing impairments are often thought of as related to the extent of the volume of hearing, but they can also be related to the clarity of sound. Hearing impairments can occur as a result of 1. Loud noises, 2. Inherited disorders, 3. Injury, or 4. Illness. Hearing impairments in children can influence the child's speech, language, and social development. Hearing impairments are medically defined by audiometric test results. 0 to 25 dB is normal hearing, 26 to 40 dB, mild hearing loss, 41 to 55 dB, moderate hearing loss, 56 to 70 dB, moderately severe hearing loss, 71 to 90 dB, severe hearing loss, and greater than 90 dB is profound hearing loss. Hearing impairments can be treated with surgical procedures, hearing aids, or cochlear implants. Psychiatric. Anxiety disorders. Symptoms of anxiety disorders manifest as nervousness, restlessness, fatigue, irritability, heart palpitations, or worrying. Common anxiety disorders include generalized anxiety disorder, panic disorders, sudden episodes of fear or impending doom, or phobia-related disorders, which is fear of specific items or circumstances. Anxiety disorders are often treated with anti-anxiety medications, antidepressants, beta blockers, and therapy. Mood disorders. Mood disorders exhibit symptoms that affect an individual's mood, such as major depressive or bipolar disorders. Depression and bipolar disorders are often treated through a combination of therapy and medication, where common medications for depression include monoamine oxidase inhibitors, or MAOIs, or selective serotonin reuptake inhibitors, SSRIs. And common medications for bipolar disorder include lithium, anticonvulsants, antidepressants, or other atypical antipsychotics. Personality disorders. These are based on unhealthy patterns in thought, behaviors, and actions, which make it difficult for the individual to relate to everyday social circumstances. Many individuals with personality disorders do not recognize that their thinking or behavior is peculiar and therefore criticize others for the challenges they face. Personality disorders usually are classified as 1. Paranoid, 2. Schizoid, 3. Schizotypal, 4. Antisocial, 5. Borderline, 6. Histrionic, 7. Narcissistic, 8. Avoidant, 9. Dependent, and 10. Obsessive compulsive. Psychotic disorders. These disorders are often long-term mental conditions such as schizophrenia. Psychotic disorders manifest as peculiar, incoherent, or unreal thoughts, speech, or behaviors. Psychosis may also include hallucinations, where the individual hears or sees things that aren't actually there. Individuals with psychotic disorders may also exhibit anxiety, depression, sleep issues, or difficulty functioning. Oftentimes, there are no known causes for psychotic disorders, but they are likely influenced by both environmental and genetic aspects. Both therapy and medication treatments are common. Antipsychotic medications include clozapine, prochlorperazine, haloperidol, loxapine, thioridazine, thioxine, flufenazine, and thioridazine. Trauma or stressor-related disorders exist as a result of exposure to traumatic or stressful events. The symptoms of trauma or stressor-related disorders can be acute, such as anxiety, depression, or fear, or they can exist as significant reactions to the stressful situation, like aggression, anger, anhedonia, the inability to feel happiness, or dysphoria, extreme dissatisfaction. Post-traumatic stress disorder, or PTSD, is an example of a trauma or stressor-related disorder where an individual who experiences a shocking or scary event will have triggering episodes which cause the individual's fear response to take over, even when they aren't in direct danger. Education, counseling, cognitive behavioral therapy, and anxiety management can all be effective treatments to help individuals who experience PTSD or other related disorders. Developmental. Attention Deficit Hyperactivity Disorder, or ADHD, is a very common neurodevelopmental disorder that historically has been most frequently diagnosed during childhood, but can also be diagnosed in adulthood. Individuals with ADHD often suffer from inattention, hyperactivity, or impulsivity, which can lead to difficulty building and maintaining successful relationships or successfully performing in a school or work-related setting. Some of these behaviors include being disorganized, frequently interrupting others, being inattentive, or changing the subject frequently. Because of these issues, it often leads to poor self-image or a lack of confidence. Autism spectrum disorder, or ASD, is a developmental disability where the individuals exhibit social, communication, and behavioral challenges. Individuals with ASD may have difficulty maintaining close relationships, such as making friends, engage in repetitive actions, or have limited interests in very specific things. Individuals with ASD often exhibit sensory difficulties, such as sensitivity to specific textures or sounds. ASD is considered a disorder that exists on a spectrum, which means there is a wide range of levels of impairment and skill development among an individual with ASD. However, individuals with ASD tend to have significant strengths and skills, so when provided with a supportive and accommodating environment, they can exhibit high levels of functioning. Cerebral palsy, or CP, is a disorder that affects an individual's movement, muscle tone, posture, and balance. CP is caused by abnormal brain development, which occurs before, during, or shortly after birth and can be first observed in infancy. While the specific cause of CP is usually unknown, it can be caused by an infection during pregnancy, such as meningitis, a lack of oxygen to the developing fetus during pregnancy or birth, or a traumatic head injury early in childhood. CP primarily affects an individual's mobility, which can cause stiff muscles, involuntary movements, and/or poor coordination. Helping clients with CP means providing individual support based on the specific needs of that individual, which may include physical therapy, occupational therapy, braces or splints, surgery, or medications. Module 5.3, Human Sexuality and Disability Issues. Topics covered in this review are sexuality and disability and gender and disability. Sexuality and disability. Sexuality is a complex biological expression of an individual's sexual characteristics, and these sexual characteristics are interconnected with how an individual identifies in terms of their gender, sexual feelings, attractions, and behaviors. Sex refers to the biological characteristics of an individual related to being female, male, or intersex. Sex characteristics can be related to reproductive functions. Assigned at birth refers to the individual's assigned specific sex characteristics at birth. Sexual orientation includes romantic and/or sexual preferences towards specific individuals. An individual may be considered homosexual, heterosexual, bisexual, etc. Heterosexuals are individuals who are romantically and/or sexually attracted to other individuals who have a different sex from their own. Individuals who identify as gay are romantically and/or sexually attracted to other individuals who have the same sex as their own. Lesbians are women who are romantically and/or sexually attracted to other women. Asexual, individuals who identify as asexual are not romantically and/or sexually attracted to other individuals. Pansexual, individuals who are pansexual are romantically and/or sexually attracted to individuals of different genders. Questioning, individuals who are questioning are in the process of examining and investigating their own sexuality. According to Daly, sexuality is identified by 1. Identity, 2. Intimacy, 3. Sensuality, 4. Sexualization, and 5. Reproductive aspects. Identity is the concept of being who an individual is as related to their sexuality. Intimacy is the concept of being close to other people. Sensuality is the concept of expression of one's sexuality using their senses. Sexualization is the concept of allowing one's body to be used to gain influence over others. And reproduction is the concept of using sexual function to become a parent. Sexuality and disability. Disabilities can affect an individual's sexuality in several ways. 1. The disability may limit sexual function or performance in some cases. 2. The disability may cause an individual to have poor body image since the body may not conform to societal standards. Or 3. The disability may influence how society views the interaction between the individual and their sexuality. As a means of support, rehabilitation counselors may help their clients find new ways to engage in sexual acts, learn how to deal with societal discrimination, and develop a sexual identity that is not in conflict with their disability. Sexuality and discrimination. Sexuality in individuals with disabilities has been largely stigmatized, where society often views individuals with disabilities as lacking in many sexual aspects, not having a sex drive, unavailable to perform, or unable to conceive. Individuals with disabilities may not fit what society has stereotyped as typical beauty, and therefore these individuals may be viewed by society as unable or undesirable for romantic relationships or building families. Because these perspectives are so ingrained in society, they can influence an individual with disabilities' ability to find value in themselves, engage in relationships, make new friends, or focus on sexual expression. Gender and disability. Gender identity relates to how an individual views their societal role as a result of their personal sense of their own gender. Much like sexuality, gender is a complex topic that includes many terms that may be unfamiliar to you. Gender identity is a personal sense of an individual's gender as they perceive their role in society. The binary gender is the concept of 2 distinct feminine and masculine genders. This is an outdated view. Gender expression is the concept of how an individual presents themselves in a public manner. Cisgender is an individual whose sense of gender identity matches their sex at birth. A cis man is an individual who identifies as a man and is also assigned male sexual characteristics at birth. A cis woman is an individual who identifies as a woman and is also assigned female sexual characteristics at birth. Genderqueer are individuals who do not identify as male or female. Transgender is an individual whose sense of gender identity does not match their birth sex. And two-spirit is an individual who identifies as having both a feminine and a masculine spirit. This term is used by some Indigenous people to describe their identities. Individuals who are in gender and sexuality communities that do not conform to society's traditional expectations often experience biases, discrimination, and societal aversions. Heteronormativity is the bias that heterosexuality is the only acceptable form of sexuality, and this belief can be particularly damaging to individuals who do not fit these expectations. Rehabilitation counselors should approach gender and sexuality with the same sensitivity that they would approach other potentially sensitive groups, because an individual's gender and sexuality can influence their views of the world and lived experiences.